Fill in any gap in front of you, please.
See a lot of friendly faces out there. Good afternoon. On behalf of the First Lady, Kristen Cooper, who is here, and we want to welcome all of you on this beautiful spring afternoon to the People's House. Thank you. You know, all of us talk frequently about how we can best support working families living on the edge. This law, once implemented, will be the working families bill of the decade. For the workers in our communities who perform some of our most essential tasks, caring for our children, tending to the sick and elderly, stocking our grocery shelves, staffing our restaurants, this law will bring many of them the opportunity for better health and a better life. The strength of our communities depends on the health of our people. And today is a historic step toward a healthier North Carolina. When this law takes effect, it'll make health care accessible for more than 600,000 North Carolinians, many of them in the grips of mental illness or substance abuse who need health care, not handcuffs. Parents who can't buy their medication because they have to pay for rent or keep their kids fed. Veterans who served our country but don't have VA benefits. Hundreds of thousands of hard-working North Carolinians, many with 2 or more jobs, have suffered in the health care coverage gap while a solution sat just out of reach. With this law I'm about to sign, many of them will be close enough to grab it. And when they do, that can mean no more missing out on preventive health screenings and regular checkups. No more turning to home remedies for chronic conditions when they can't afford prescription medicine. No more dying from preventable or treatable illnesses. The lack of health care is not just a personal crisis, it's an economic crisis too. With this bill, more uninsured North Carolinians can avoid financial ruin from unpaid medical bills. More rural hospitals will be able to stay open with their jobs. Businesses won't lose as many good workers to illness or to care for a sick family member. Insured people can pay lower premiums because there will be fewer uninsured people who can't pay. And people will have access to more doctors, nurses, and mental health professionals because there will be more people who can pay them. It's clear that this legislation I'm signing today will have a positive effect for all working families, even if they don't directly get Medicaid. I'm deeply grateful for all of the advocates here and across the state who have spent years fighting for this day. Child care advocates, healthcare workers, veterans groups, hospitals, people of faith, Care for Carolina, and dozens of nonprofit groups, business leaders, sheriffs, and local elected officials from both parties who've seen the toll of this crisis up close, and uninsured workers and their families who have bravely told their personal stories. Thank you to the Democratic legislators and a number of Republican legislators who never wavered in their support for Medicaid expansion. And thank you to the Republican legislative leaders who ultimately approached this issue with a willingness to change their minds to find a solution that worked for North Carolina. And there is no question that through these negotiations, you've not only done the right thing, but you have also made historic gains for healthcare competition in this state, something many of you have long sought. Thank you, President Pro Tem Phil Berger, House Speaker Tim Moore, Senate Democratic Leader Dan Blue, House Democratic Leader Robert Greaves, for helping lead the way to get this done. Now I'm going to recognize these legislative leaders in that order to say a few words. First, Senator Berger.
Thank you, Governor. First thing I'd like to do, if you're a member of the North Carolina Senate and you're here, or if you're a staffer for the North Carolina Senate, if you just raise your hand. I'm sure the Speaker will recognize the House folks, so don't feel left out. But because, you know, these are the folks that made sure not only that we got this done, but that we got it done right. And so they deserve a great deal of credit. You know, 12 years ago, North Carolina had a broken Medicaid system. There was no way that system could have handled an influx of hundreds of thousands of new enrollees. We in the legislature undertook transforming the program from a fee-for-service model to a managed care model. That provided us with better budget predictability and put more focus on quality of care. Now we have a Medicaid system that is stable. By transforming our state's Medicaid program, we're now in a place where our system can handle those additional enrollees. But just because we have a stable system doesn't mean we can give hundreds of thousands of people new insurance cards without consequences to that system. That's why it was imperative that in expanding Medicaid, we address the availability and cost of health care. We were able to chip away at those issues with this bill. The Certificate of Need reforms in the bill takes direct aim at regulations that are the biggest impediments to the availability of health care and the regulations that increase costs. These changes will make North Carolina more attractive for providers, healthcare facilities, and hospitals willing to do business and to compete here in North Carolina. So while this is a momentous occasion, our work is not done. We need to continue to forge ahead with additional supply-side reforms. We were able to make a good dent in reforming our state Certificate of Need laws, but we can do more to remove the red tape that healthcare facilities and providers face in North Carolina. We still have a provider shortage that hurts our rural communities. Medicaid expansion will not solve all the problems our citizens encounter when they seek care. But if we see this as an opportunity to further chip away at archaic rules that prevent our citizens from accessing care, we can enhance real and measurable access to health care here in North Carolina. I look forward to continuing to work to remove those barriers to care. Again, I want to thank you, Governor, thank you, and legislators and legislative staff, thank you so much. And now I'll turn it over to Speaker Moore.
Good afternoon. Well, it's an honor to be here today, and it is especially exciting to see so many of my colleagues here. I would say if you're a member of the House, please raise your hand as well. Got a few of them, and it's the House staff as well. You know, this has been a long day coming, but it's been one as a result of a lot of reforms that Senator Berger mentioned about earlier, where we changed the way Medicaid was funded in North Carolina to go from a fee-for-service to outcomes-based, and it has saved hundreds of millions of dollars all these years. It's allowed us to be in the position that we're in today to be able to expand this coverage. But, you know, this is only one part of access to health care, Governor. We all know this. we talk about access to health care in terms of who's going to pay. We have areas of our state that still are underserved in terms of, if you have a medical emergency, will you make it to the hospital in time? Can you get access to those providers you need? We know there's a significant shortage when it comes to behavioral health, and we see that all the way through the system affecting education, jobs, the criminal justice process. We know this is going to absolutely be an amazing opportunity to make great strides in that direction. The amount of money that's going to come in through the hospitals, through HASP, to put more money into direct care, to provide services to rural areas, is something that will be of a generational impact. As we work through this process, I do have to give a shout out to, I know there are folks here who are providers, folks from the hospitals, a number of stakeholders who've been involved. Thank you for the tireless efforts you all have made over these last few months. We got really close last year, and we realized that we probably weren't quite there, but we could get there this year. And I'm very fortunate that we're here on a nice spring day with the dogwoods blooming to be able to see this sign. So, Governor, thanks for having us today, and congratulations.
All of you know the song, it's going to be a bright, bright, sunshiny day. Although the sun is not shining everywhere, today is that day. It's been a long time coming for North Carolina, and we've waited anxiously for it. And I want to acknowledge the persistent advocacy of Governor Cooper over the last 6 years, and folks like Dr. Mandy Cohen, Secretary Cody Kinsley, and the Republican leaders who've worked tirelessly to see Medicaid expansion come across the finish line. Lawmakers may be divided on some issues, but we accomplish more for North Carolina and its people when we work together. Now, the other thing about this is, last time I was standing here with the governor and these other legislative leaders, we were doing an economic development celebration. And I submit to you today that this is probably the biggest economic and jobs announcement that this state has ever seen. We're looking at $8 billion in economic impact annually, not just one and done, but annually. 83,000 new jobs created, and accessible and access to affordable health care for over 600,000 people. That's a number that boggles my mind, because these, for the most part, are working people in North Carolina. And when you think about it, there are neighbors, grocery store clerks, home health aides, those folk who are going to take care of us at some point, daycare providers, taking care of our young folk, farmers, veterans, and barbers and beauticians, and everybody who looks out for us and works hard every day. By becoming the 40th state to expand Medicaid, we're saving rural communities and we're saving lives. You know, this legislative process that we've engaged in over the years reminds me of so much. And I constantly talk with Senator Berger. I grew in the concept of Medicaid management and expansion of Medicaid as we did. And I commend him for growing in the thought of Medicaid for working North Carolinians. Now North Carolinians will be able to breathe easier, knowing that they can afford to see a doctor about an ailment that's been bugging them before it becomes life-threatening. More working adults can afford to find mental health providers and get the help that they need. And more people won't have to choose between paying for prescriptions or paying rent. And we can all look forward to improving the quality of life for many, many, many more North Carolinians and all of their progeny. And so I'm glad to celebrate here with you today, and all of us should be very grateful for this bright, bright, sunshiny day. And now I want to bring up the Democratic leader from the North Carolina House, Representative Robert Reeves.
Good afternoon, everyone. I can't tell if I'm being heard or not, so I hope you can. So good. So I can't help but think when I'm seeing today, the first thing that pops in my mind are hundreds of thousands of North Carolinians that have been waiting for this day. I think of the legislators and advocates that started this fight years ago because it was so personal to them. If you've grown up in North Carolina, you've either grown up in a rural community or been touched by a rural community. And I think about all of those family members whose lives will now be saved. I think about all of the friends and family who not only don't have to choose between paying for groceries, paying for a child, and going to the doctor, but who just have the comfort of knowing that if there's some ailment going on, they can go find out. Because there's nothing more frightening than sitting with what you think is a little cough, what you think is a little issue, but being scared to death, not knowing what it is, and now knowing they can go. I think about the people who are now going to be able to go to emergency rooms and the doctors and the nurses and the assistants that work in there who can handle the actual emergencies because they're not having to tend to people who have nowhere else to go. I think about the fact that this is another sign that tells us who we are as North Carolinians, that our people matter over everything else. No matter what we do, no matter how much money we bring in, no matter what's going on, that what matters is we have the healthiest, happiest citizens that we can have. And I am thankful, Governor, for your tireless work because it's work. The easy thing to do is to back away on issues like this. The easy thing to do is say, to test political wins, to look around and just say, well, I'm not real sure where this is going to go. The hard thing to do is to stick to that work knowing it's the right thing to do. And I commend you, Governor, for your stick-to-itiveness. I commend all of our legislative leaders, all of our legislators, all those legislators who are no longer here that worked and cared. We appreciate you. And I ultimately think of one thing in particular, now that I'm standing here, is that 4 years ago, whenever I was blessed enough to have the opportunity to lead the House Democratic Caucus, the thought of being on this lawn this many times with these Republican and Democratic leaders and our governor was outlandish. And now we have done it numerous times. And I would reiterate what Leader Blue said, when we work together, when we forget our politics, when we forget about all the other things that can get in our way, and we think about what's the thing that helps our people, we do great things together. And I don't think it's an accident that every single one of these announcements we've done has been sunny. Take that as a sign, folks. So I just ask that you all pray for the people who now have this opportunity. Pray for the people who have worked so hard on this. Thank you to all the staff and everybody else. And pray that we continue to figure out ways to invest in our people and make this the greatest state that we know it is in this country. Thank you.
There are many tireless Medicaid expansion advocates out here today, but I'm going to introduce one of them to you, who is the owner and operator of Little Believers Academy Incorporated Child Care Center, Cassandra Brooks. Cassandra?
Thank you. Thank you. As I look back and I reflect upon the reason I started this Medicaid expansion advocacy work was due to losing two child care teachers, Ms. Brenda Purnell and Ms. Kathy Faulkner. They were excellent early childhood teachers who didn't have health insurance and passed away due to preventable health conditions. Several child care professionals have passed away over the years. In addition, educators who lack a health insurance have been unable to receive medical treatment. Right now, as many of you know, it is difficult to operate a small business. It is difficult in our current economy because we need so many employees, yet we have to be competitive and offer so many benefits. And being able to offer health insurance will definitely be a large stake in the ground for North Carolina small business. I'm extremely thankful to the small business owners who stepped up and spoke out about the importance of needing to offer health insurance to their employees. Providing access to health care will be another avenue to help small business in North Carolina succeed. I'm glad that I continued on this long journey to push for Medicaid expansion. I'm thankful to the North Carolina legislators who have really stepped up and worked together. I'm always very prayerful for them and the governor. I'm thankful for Governor Cooper, who has pushed the need for health care since the beginning and didn't stop until this was completed. I want to say here's to Medicaid expansion in North Carolina. Here's to supporting small business in North Carolina. Here's to continued growth in North Carolina. I believe in North Carolina. Thank you.
There have also been many strong leaders over the years, and too many for me to start naming, and I don't want to start going there, but one of them has been our Secretary of the Department of Health and Human Services, Cody Kinsley. Cody.
They started it, so I'll start it. I would like to thank the members of the Department of Health and Human Services, some of whom are here today, but who are 18,000 strong, who work every single day tirelessly to help the people of North Carolina be well, and who have been through such a challenging several years, who I know have been so hungry for this tool. Thank you. Thank you, Governor, for your leadership and your steadfast support of Medicaid expansion as an unparalleled tool to invest in the health and well-beings of North Carolinians. Thank you, Senator Berger, Speaker Moore, Leader Blue, and Leader Reeves, for your leadership and partnership. I have and continue to value the opportunity to work closely with each of you and know that even in times of difference, through our discourse, we often find common ground. And it's the actual common ground that we stand on today, North Carolina, and doing right and well by our family, friends, and neighbors that is the root of our shared public service. And thank you, Ms. Brooks, for centering us all today on what I know this is really about. The story of two North Carolinians that echo 600,000 other stories. Stories that I know that have inspired all of you gathered here and countless others across North Carolina to action. Stories that clearly ask the question, how can we do better to care for one another? To care for the working parent who has 2 jobs but still can't afford health insurance. To care for those in rural communities who can't afford to drive 60 miles when the risk of death may be minutes ahead. To care for those with mental illness who deserve so much more than being stuck in an emergency department or anywhere else for that matter. Medicaid expansion is an answer to that question. The opportunity to make smart investments in prevention and the things that drive health. The opportunity to see a healthcare provider when you don't feel well before it's a bigger and more expensive problem. The opportunity to stabilize providers and ensure the safety net is here for all of us when we need it. And perhaps just as momentous as what happens today is how we got here. They say if you want to go fast, go alone. If you want to go far, go together. Well, friends, on this beautiful sunny day, we are here together. And it has been a long road. But I am so incredibly confident at the prospects for the health and well-being of North Carolina. If we continue to link arms and continue to tackle hard problems, we will be unstoppable. Thank you.
Okay, I'm going to ask everybody to move over here. We're going to get this thing done.
y'all just fill in. Y'all can come down as well.
Check.
We're gonna have our speakers in the front. Otherwise, y'all can fill in around the side. We got some. Y'all can keep coming around the side. Good to see you.
I think we're gonna have to move. You guys got to move back just a little bit.
I was standing behind you. I hit your back.
A good crowd back there. Everybody got my back, right?
I got your back.
So what time is it?
4:25.
And it is the 27th, right?
27.
With a P beside the 5.
You were exactly right. Using too many pens for this. Let's see, the 27th. Day of March. We have a Medicaid expansion bill. Okay, guys, we'll now take a few questions from the podium, and then everybody can hang around and we can have some fun together. We're going to do it from here, or let's do it from podium, if you don't mind. Let us get back there. You know, I think what's important about this is that we have agreed on how to expand Medicaid, and it's only a question of when and not if. And I think that's where we are right now. We know that this is going to happen. It's just a question of when, and the House and the Senate seem to be excited about going ahead and doing a budget early. So that's good to hear. We'll just see how that goes. Yes. Well, I think it's an important piece of legislation that I believe should not go into effect, but we'll see how the votes go. Well, I know one thing. We have been strong in creating a lot of jobs in North Carolina, thanks to the cooperative work of everybody up here. Jobs are coming in droves. And the president has said how important it is for semiconductor and chip manufacturing to happen in the United States with American jobs. And with Wolfspeed, that's what we have in North Carolina. They've agreed to do it right here. And the president's going to come to celebrate that. And a lot of it is because of the CHIPS Act that was passed just this past year. Thank you, guys.